Ladies and gentlemen, please take your seats for our closing plenary session. I know that the workshops prompted many interesting discussions, and it sounds as though many of those discussions are continuing, and we'll hear more about that as input to the ministerial panel later on in this plenary session. But before then, we have a very distinguished keynote speaker for this final closing plenary session of this conference of the Belgian presidency on the European Health Union, Commissioner Kyriakides. I don't know that there's very much to say, Commissioner, to introduce you. You have been the Commissioner who has been here during some of the most remarkable, you've stewarded some of the most remarkable changes that we've seen in the European Union's action on health in the history of the European Union. This comes at a pivot point during the presidency of Belgium and on debates on the future of that European Health Union, and we are delighted to have your contribution and hear your perspective. Thank you.
Deputy Prime Minister Van der Broek, Excellencies, it's a great pleasure, ladies and gentlemen, to be able to be here today, and delighted to be able to join you and discuss with you and share really the future of the European Health Union. Many of you here today have been part of this journey from the very beginning, and I know shared the vision. So it's a wonderful opportunity for myself to be able to tell you where we are today and where we see the direction that we're going to be moving. So first of all, I want to thank the Belgian presidency for inviting me and for inviting us here at this beautiful Musée des Beaux-Arts, and for shining such an important light on health throughout its presidency. But before we look into the future, if I may be allowed, I'd like us to take a step back for a moment. In 2019, on December 1st, it was in fact just less than 2 months before we started dealing with COVID-19, I received a very far-reaching mission letter from President von der Leyen. And it was a blueprint for action that really reflected where we wanted to go as a Commission. And really the personal determination to improve health across the EU. And I'm proud to say that since 2019, we have translated that, I would say, ambition into a number of deliverables. Today, Europe's Beating Cancer Plan is making a real difference for patients and families and carers across the EU. We have negotiations ongoing to deliver a game-changing reform in terms of the pharmaceutical legislation. The proposal came 20 years after the previous one. And I was very delighted that we managed to reach a political agreement recently with the European Parliament and the Council on the European Health Data Space, which will boost research and empower citizens and maximize the potential of e-health. So this is part of what was in the mission letter and where we wanted to go in 2019. Of course, as all of us know in this room, this has turned out to be a great deal more challenging. And I would dare say even more far-reaching and ambitious than we first expected. Only a month after we came into office, COVID-19 appeared, and this pandemic taught us some very difficult lessons. But I think the most powerful takeaway point that I would hold is that we are stronger together. And we can achieve great things when we work together as a European Union and when the member states work together as a Team Europe. Saying this, it also taught us that we cannot only work together when we're working within Europe, and we need to reach out and work across the globe, and I will come to that, but with all our partners as well, And I'm very glad to see the Regional Director of WHO, Hans Kluge, here, who was from day one working very closely with us. With the EU vaccine strategy, we managed to make life-saving COVID-19 vaccines available to all member states and all citizens at the same time. And this was a historic moment for the European Health Union. And it showed that it's a union that delivers for its citizens. And I dread to think what citizens would have felt if they saw that those life-saving vaccines at that time of the pandemic, when we were having the pictures and living with fear, many families, on a daily basis, if vaccines were available in some member states and in other member states they did not have vaccines for months to come. So it showed us that we could deliver, and that we could deliver as a union for health for all citizens equally. And equity in health is fundamental in a European health union. It also showed us something else, that we could not continue in the area of health with business as usual. We learned these lessons, we listened to citizens, and we responded with concrete actions. And in November 2020, we presented our vision for a strong European health union. And a strong European health union in which member states would be prepared and respond together to health crisis. A strong European health union where essential medicines would be available for all at the same time. And a strong European health union where all citizens would have access to the best standards treatment of care. We created the Health Emergency and Preparedness Authority, HERA, which is an essential part of that. And thanks to the efforts of all and the support of the member states and the European Parliament, I believe that Europe is in a better place today to prevent and tackle pandemics and emerging health threats. But we're not there yet, and we're definitely not finished. It was clear that for years we had to reverse what was chronic underfunding for health systems. Good health is an investment, and now member states are being given the necessary funds to build more sustainable and resilient health systems. And overall spending on healthcare-related measures, member states have, through their recovery and resilience plans, investing over 60 billion euro. So we can see how within member states, health has now become a political priority. And the Commission had put forward at the time the most ambitious program in terms of health, EU for Health, and it is the most ambitious funding program that we have ever had, and this has enormous potential to deliver real change. If I may share with you a little bit of this European Health Union and what it's about, because it's not a vision, it is now actually delivering, and it is set on what I say are 6 pillars. First of all, we have stronger cooperation framework on cross-border threats, because we have revised the regulation. We have strengthened the mandates of ECDC and EMA, the European Centre for Disease Prevention and Control and the European Medicines Agency, so they are able to respond in a more structured way, faster to future health threats. We created HERA, which I have already mentioned, and this has already delivered concrete results to the member states. So these are the first 2 pillars about preparedness, prevention, preparedness, and response. Europe's Beating Cancer Plan is its 3rd pillar. This is a political priority for the Commission, has been from the beginning. It is a personal priority and mission for myself. And 4 years into the plan, we already see the actions delivering in the member states, benefiting cancer patients, families, and carers. We have new screening guidelines after 19 years. We have created a new knowledge center on cancer. We have the first time an EU inequalities cancer registry. And I'm going to put a little parenthesis here. Why is this important? Because in order to know where you're going to focus your policies and target your funding, you need to know what is the environment, what is on the ground. And this, for the first time, we've mapped the inequalities that exist for cancer care, screening, diagnostic, and treatment, not only across member states, but within member states. And this allows us to know where we need to focus. We have created an EU network for young cancer survivors, so that they can network together, so they can share, they can talk with experts. And there is much more to come. We, for the first time, have brought to the European level the initiative of the right to be forgotten, to end financial discrimination for those who have experienced cancer. And again, a huge thanks and appreciation to the Belgian presidency for putting this at the top of the agenda. Because discrimination after you finish cancer treatment in terms of access to financial services is not acceptable in the EU of 2024. The fourth pillar, I mentioned it also before, is about access to medicines. You cannot have first and second class citizens in the EU in terms of access to medicines. And that's why we proposed a historic pharmaceutical legislation reform after 20 years to create what we call a truly single market for medicines, to ensure universal access for medicines for patients, and at the same time to preserve a thriving and very vibrant innovative pharmaceutical industry. And next month, we will be launching a Critical Medicines Alliance, which will contribute to the coordinated action at EU level to prevent shortages of medicines. The first time we're bringing together all the stakeholders and industry and the member states to work on this. The fifth pillar is the digitalization of health. Mentioned the European Health Data Space, a bold new framework. This will give patients a full control of their own health data, always backed by the highest standards of privacy and data protection, because if they don't trust the system, then they're not going to be able to use it. And at the same time, in the secondary use of data, it will help scientists and researchers and industry pull data together across the EU and will really help us develop life-changing medicines, especially important for rare diseases and more. And the last and not least final pillar is mental health. For the first time, we presented a comprehensive approach to mental health. After so many years, mental health, which is part and parcel of health, we presented a comprehensive approach to break the stigma about this, to make a positive difference to every citizen, focusing especially on young people. And again, thank you for putting a focus on this during this presidency. At the same time, while the European Health Union is evolving, we are at an era where we are constantly tackling a very complicated and, I would say, interlinked crisis that are ongoing. And it's the greatest challenges that we are facing are from climate change to AMR, antimicrobial resistance, and these are common challenges. They don't respect borders, as viruses don't respect borders, and we can only meet them if we have a One Health approach. So we came together as Team Europe, the institutions and the member states, and we pulled all our resources and our expertise, showing clearly that we are a geopolitical commission. For example, our support of Ukraine is a strong example of this. More than 2 years have passed since Russia's invasion, and we immediately worked and are still working with the ministries of health of Ukraine, so that in the EU, member states have received over 3,000 Ukrainian patients as part of our medical evacuation system. We've donated hundreds of millions of COVID-19 vaccines to partners across the world, because COVID really reminded us that health is global, and we need to approach it in this way. We need to strengthen global governance, we need to strengthen preparedness and response, and these are the principles that lie at the center of our EU Global Health Strategy, which we presented in November 2022, and this is our vision for leadership and cooperation on global health for the next 10 years. So this is where we are in terms of the European Health Union, which has its European dimension, but also a very strong external global dimension. Ladies and gentlemen, I'm going to end here and apologize because immediately after my presentation I need to get back to college. And I will be missing this very interesting panel, but I will, I'm sure, hear all the feedback. But I just want to share with you that the European Health Union and what we speak about is an ambitious possible vision for EU efforts in the area of health. What it does actually, it builds on the solidarity that we saw we needed to have on the collaboration coordination at the time of the pandemic. And I believe it's going to be one of this Commission's lasting legacies. And it cannot be achieved without the support of the Member States, of course, the European Parliament, and all those working within the Commission, because it's important that we listen to citizens, and this belongs to citizens. If anything, I will have as a take away with me when this mandate ends, is the fact that we are actually delivering on what citizens expect from us. And we are delivering because we are seeing the tangible results in the Member States that I am visiting, that I'm in contact with. So let's all work together, keep on moving forward with the European Health Union, but more importantly, keep health as a top political priority. Thank you.
Thank you very much, Madam Commissioner. Thank you for that contribution and for that overview. And rest assured that the issues that you have raised will be taken fully into account in the continuing discussions and reflect indeed many of the themes that were identified during the different workshops in